Do you take one or more prescription medications? If you do, check out this video as I'm going to discuss some of the common types of prescription medications and which nutrients they actually can be draining from your body. What's up and welcome to the video. I'm Dr. Daniel Ricciardi, gut health expert, licensed pharmacist, fitness enthusiast, and creator of SIBO Shortcut, the program designed to give you all the info and support you need to successfully get rid of small intestinal bacterial overgrowth. For more information, click the SIBO Shortcut link below. In this video, I'm going to discuss 9 of the most common types of prescription medications that may be reducing the vitamins and nutrients that your body needs in order to be healthy. I'm going to explain what types and specific medications these are. If you're taking prescription medications, there's a fairly good chance you're going to be using at least one of these. And I'm also going to be talking about which specific nutrients they can reduce. Finally, stick around to the very end of this video because I'm going to provide you with an additional resource you can use to learn more information on this topic. As a quick disclaimer, this video is for informational purposes only. Never discontinue a prescription medication or change one without consulting your doctor. The suggestions or information in this video may not be appropriate or safe for everyone to follow. Let's get started with the 9 types of medications. Number 1 are statin medications. From my 10 plus years of experience as a pharmacist, these are one of the most common prescription medications that get prescribed. Some popular brand names are Lipitor, Crestor, and then there's also a lot of generics: simvastatin, torvastatin, rosuvastatin, lovastatin. This is not a complete list, just rattling off some very commonly prescribed ones. They're mainly meant to lower LDL cholesterol. There's a lot of evidence pointing to the fact that these type of medications, statin medications, can deplete a substance known as coenzyme Q10, also known as CoQ10. CoQ10 has known benefits for heart health, brain health, and just your body's overall health, as it's involved in energy production and the way that your cells maintain and take care of themselves. It's an important nutrient for muscle strength and endurance, including the strength and endurance of your heart, to be specific. Besides coenzyme Q10, vitamin C and glutathione are a couple other substances that are commonly depleted by statin medications. Second type of medication is a diabetes medication called Metformin. Metformin is a mainstay in diabetes treatments. It definitely has some good qualities, and there's studies showing that it can reduce your hemoglobin A1C. However, metformin can also very rapidly deplete your vitamin B12 stores, which, if you have diabetes and are experiencing diabetic neuropathy, which is nerve pain, this can potentially make this worse. So for metformin, nutrients reduced, vitamin B12, and then folic acid or folate is another one. Diuretics can also deplete certain nutrients. These are most commonly used as medications to lower blood pressure, but they can also sometimes be used for edema, which is when you have excess of fluids that get pooled up around your feet, ankles, or lower legs. Some common diuretics include hydrochlorothiazide, which is HCTZ, which can deplete potassium, magnesium, and sodium. If you know a little bit about these, you may be saying, but Dan, that's kind of the whole point of taking the diuretic. It's because it does eliminate some of the sodium from your body, which can lower blood pressure. I totally get that. However, magnesium and potassium are also pretty important for a lot of different functions, so this is still something to be aware of. There are what are known as potassium-sparing diuretics, such as spironolactone, also known as aldactone, but instead of lowering potassium with this one can actually increase the level of potassium in your body, which is a little bit different than what we're talking about in this video, but it is noteworthy in certain situations. Angiotensin converting enzyme inhibitors, also known as ACE inhibitors, are a common medication used for blood pressure, sometimes heart failure, and even kidney conditions. Some examples include lisinopril, benazepril, and enalapril. Like the statins, these may also deplete coenzyme Q10, and like spironolactone, these may also increase levels of potassium. Medication type number 5 are proton pump inhibitors. As it shows in this 2013 research article, PPIs have been associated with an increased risk of vitamin and mineral deficiencies impacting vitamin B12, vitamin C, calcium, iron, and magnesium metabolism. Some common proton pump inhibitors include Prilosec, Nexium, and then for the generic names of them, the most common two are omeprazole and esomeprazole. They can deplete nutrients because the way that they work, which is lowering stomach acid, this makes it more difficult for your body to appropriately digest its food and therefore absorb these nutrients from the food. Medication type number 6, non-steroidal anti-inflammatory medications, also known as NSAIDs, things such as Advil, Aleve, which are ibuprofen, naproxen, aspirin. These may contribute to lowering your body's stores of iron and folate, and chronic use may also lead to damage to the gastrointestinal lining. This can contribute to the digestion and absorption of nutrients over time. Lastly, I did see one study as well talking about non-steroidal anti-inflammatory drugs where they can actually inhibit the amount of melatonin that your body produces. Melatonin is basically the nighttime hormone that helps you feel sleepy. And in one older study, they found that melatonin can actually be inhibited up to 75% from taking NSAID medications. Next type of medication is warfarin, which is also called Coumadin. Warfarin is a blood thinner that is prescribed to prevent blood clots. It can deplete vitamin K, more specifically vitamin K2. I do want to be very clear in mentioning here that nobody under any circumstance should ever switch their warfarin dose or discontinue it without talking to your doctor. This is a very important medication, and it's easy to get too high of a dose or too low of a dose. So as I said in the disclaimer in the beginning of this video, don't take any specific actions on your own. I just wanted to make you aware of certain things that can happen from taking certain medications. All right, medication number 8 are selective serotonin reuptake inhibitors. These medications are commonly used for mental health conditions such as depression and anxiety. Some examples are Paxil, Zoloft, Prozac, and then some of the generics are sertraline, fluoxetine, and escitalopram. While these initially are really good for increasing the levels of serotonin in your body, over time, because of their mechanism of action, a phenomenon known as desensitization of the receptors can happen, which means that even though there's more serotonin in the synapse where we want it to be, the receptors get less sensitive to the serotonin, therefore its effect becomes less. In addition to serotonin, these SSRIs have also been associated with reduction of sodium levels. And then finally, number 9 are oral contraceptives, aka birth control, aka birth control pills. These have been associated with a variety of nutrients depleted. This 2013 study indicates it has been shown that the key nutrient depletions concern folic acid, vitamin B2, vitamin B6, vitamin B12, vitamin C, vitamin E, and the minerals magnesium, selenium, and zinc. All right, there you have it. Those are the 9 common prescription types of medications and some key nutrients that they may be draining from your body. If you want to learn more about this specific topic or see which medications you take and whether they may be depleting nutrients, a pretty cool resource that I found is a website called mitavin.com. This website may not have every single nutrient or vitamin that can be depleted, but from my experience, it does a pretty good job of listing some major ones and giving clinical studies that show how strong the evidence is and what nutrients are depleted. So there you have it. With that said, is it necessary to run out and just buy all these vitamins in supplement form? No, but I do think that if you are taking prescription medications, that it is good to be aware of what situations may happen. If you are looking for quality vitamins, in my full script, you get 20% off. Link is below. And then next week, we're going to add onto this video with a follow-up where I'm going to reveal some typical symptoms that you may experience depending on the type of nutrient or vitamin deficiency that you have. That is all for today. If you enjoyed the video or found it helpful, please give it a like and subscribe to my channel for more related content. Thanks so much for watching, and I'll see you in the next video.